As a parent, how do you know if your teen is showing symptoms of bipolar disorder? What exactly is bipolar disorder in the first place? This video is going to help answer those questions. My name is Emmanuel with Sandstone Care, and here we treat teens and young adults with mental health, addiction, and substance abuse treatment. We do offer different treatment programs like Teen After School IOP, Teen Day Treatment, and also Teen Residential. But before we dive into those things, first, I'm going to be breaking down what bipolar disorder is, share some common symptoms to look out for, and then talk about some next steps that you can take if you think it's time to consider treatment. Let's jump into it. What is bipolar disorder? According to the National Institutes of Health, or NAIH for short, bipolar disorder can be defined as a mental disorder that causes unusual shifts in your mood, energy levels, activity levels, your concentration, and it affects your ability to complete everyday tasks. Someone who's been diagnosed with bipolar disorder can expect to experience times when the mood feels up, they feel like they have lots of energy, they're fully energized, but after these moments, they're normally followed by an amount of time when you're feeling down, you're feeling hopeless, or possibly even sad. These patterns between moods can be referred to as episodes of mania, again, feeling excited, feeling like you have lots of energy, then followed by depressive episodes, meaning you're feeling down or sad. An estimated 3% of adolescents aged 13 to 18 years old have bipolar disorder. This helps us know that this is somewhat a common disorder that often develops in young adults. What are some signs and symptoms of bipolar disorder? Let's dive into some signs and symptoms to look out for, so that way you know if it may be time to talk with a professional and get a proper diagnosis. Now, with bipolar disorder, remember, there's episodes of mania and depressive episodes. Because of that, I'm going to be showing both the symptoms to look out for during a manic episodes and symptoms to look out for during a depressive episode. Let's jump into it. For manic episodes, some symptoms to look out for include feeling very up, elated, or irritable, showing intense silliness, feeling high in energy or jumpy, decreased amount of sleep, a loss of appetite. They seem to be talking very fast. They're experiencing racing thoughts. This person is trying to do a lot of things at once. And lastly, you're seeing them engage in risky behavior. In terms of depressive episodes, some signs to look out for are this person is feeling down or hopeless, feeling restless, having sleeping problems, and increased appetite. They're isolating themselves, they're talking very slowly, they're having trouble concentrating, there's this difficulty doing simple tasks, there's also little to no motivation in doing things, and lastly, this individual is having suicidal thoughts or even feelings of worthlessness. As you can see, there's a lot of different signs to look out for if someone is struggling with bipolar disorder. That's why I can't stress enough. If you're feeling any of these signs, then it might be time to talk with a professional counselor, therapist, or even a psychiatrist. Talking with a mental health professional will help you know if the signs you're seeing are for a diagnosis of bipolar disorder or if the signs you're seeing are for another mental illness altogether. If your teen has bipolar disorder, what treatment options are out there? Up to this point, we talked about what bipolar disorder is and some signs and symptoms to look out for. Now we're going to get into the nitty-gritty and talk about the treatment options that are available for teens who do struggle with this disorder. The treatment options we're going to look at are Teen Residential, Teen Day Treatment, and Teen After School IOP. Real quick disclaimer. Even though there may be some overlap with other programs that are offered out there, these treatment options are based on the programs we offer here at Sandstone Care. First on the list, Teen Residential Treatment. Teen Residential Treatment offers a home-like environment to help teens with substance abuse or mental health disorders. This type of treatment option involves a live-in setting, meaning that you'll be living on site and will be provided with 24-hour care and support. Residential care is the most intensive level of treatment, and it can be quite helpful for young people with severe mental disorders, individuals who pose a risk for themselves or others, teens that have a lack of support or care at home, and even be helpful as a more intense option if other levels of care that were tried were not effective. Lastly, during these programs, teens typically stay 45 to 60 days and develop unique, individualized aftercare plans. These are plans that they set up with their therapist that involves either moving them into a different program or transitioning them back home. Next up, teen day treatment. Day treatment, which is also known as partial hospitalization program, PHP, can help teens understand their mental health or addiction struggles and help them heal from them as well. Now, our teen day treatment here involves 25 hours of weekly programming for people aged 13 to 17 years old. A typical day in day treatment can involve things like individual therapy, experiential therapy, family therapy, medication-assisted treatment, which is MAT for short, academic support, psychiatric consultations, and group therapy. This treatment option would be one to consider if you're looking to help a teen who has recently completed residential treatment or a teen who needs structure and support for their substance abuse and mental health disorder. Now, the last teen treatment program we're going to be talking about here is Teen After School IOP. Teen IOP is a longer-term program that typically lasts 8 to 12 weeks. There are a wide variety of treatment modalities that can be involved in Teen IOP. There can be things like organized physical activities, dialectical behavioral therapy, ACT or acceptance and commitment therapy, and they can also offer psychiatric consultations as well. Teen After School IOP would be most suitable for teens that are still in school but still need care, and again, still need support for their mental health and substance abuse disorders. I do want to quickly highlight that Sandstone Care does offer a virtual IOP program. So if you have a teen that lives far away from a treatment center or they have transportation issues, there are still options that they can take to get the help that they need. All right, that sums up what bipolar disorder is and treatment options out there for teens who may be struggling. Before going though, I do want to say that if after hearing this information and you are a parent and you're considering treatment options for your teen, if you don't know where to look, Sandstone Care is here for you as a resource. At Sandstone Care, we are passionate about helping teens recover from addiction, mental health, and substance abuse. So if you want to get into contact with a Sandstone Care member right now, you can actually live chat them at sandstonecare.com or contact them using the number you see right down below. I truly hope that this video has been a helpful resource for you. If you have any other questions that you would like Sandstone Care to answer, just leave them in the comment section down below and we will reply as soon as possible. Thank you so much for your time. Have a good one.